Dr. ESAT KABA, entitled Evaluation of the Relationship Between Sacrum MRI Texture Analysis Parameters and Bone Material Densitometry Measurement.
Thank you for introduction. My name is ESAT. I am from Turkey. Today I will make a presentation titled Evaluation of the Relationship Between Sacrum MR Texture Analysis Parameters and Bone Mineral Densitometry Measurements. Osteoporosis is a growing concern in both medical and socioeconomic areas, leading to an elevated risk of fractures due to fragility. The relationship between osteoporosis and bone marrow adipose tissue is still not well established. Magnetic resonance imaging is an essential tool to evaluate fat depositions of bone marrow. And texture analysis is an image processing type which determines the interrelationship of pixel intensities. What is the purpose of our study? We have intended to predict osteoporosis from MRI of the sacrum using texture analysis-based machine learning algorithms. Firstly, patients who underwent sacroiliac MRI for last 3 years, and all of them over 18 years old. Bone mineral densitometry measurements were included in our study. The time interval between MRI and BMD less than 1 year. And also, patients were divided into 2 groups according to BMD, osteoporosis and osteopenia group and normal group. All MRIs were obtained from the same MRI scanner. We used only axial slices of sacrum at the S2 level from T1 sequences, non-fat suppressing T1 sequences. And then the images were loaded into the texture analysis software program. We used Mazda software program for texture analysis. And ROIs were placed in the sacrum with the consensus of 2 radiologists. This is our ROI. This is only on the sacral bone. There is no surrounding fat tissue, and there is no including other structure. From each patient, 312 features were extracted by texture analysis, and then the results were transferred to Orange data mining software program for machine learning, and classification was performed in here. At this stage, the classification process was performed using the 5-fold cross-validation method. This is workflow of our study. Firstly, dataset 106 patients, 43 patients had osteoporosis and osteopenia, and 63 patients had normal according to BMD. And then image pre-processing, standardization was done in here. And then texture analysis, we used Mazda software program for texture analysis and for segmentation and feature extraction. And we obtained some results. The results transferred to machine learning software program. We used Orange data mining software program for open source. And firstly, in here, randomization, normalization, and feature selection was performed. And then model development, we used 5-fold cross-validation method, and we selected naive Bayes neural network and SVM algorithm for classification, and finally, results. As a result, the mean age of 5 male and 101 female patient was 54 years. And as I said, 43 patients had osteopenia and osteoporosis according to BMD, and 63 patients had normal BMD. This table shows us most related texture parameters for about result and top 10 texture parameters and their texture group. As a main result, as you clearly see from the table, the most successful algorithm was neural network. This is 75% under area curve value, naive Bayes 74, and SVM 72%. The neural network algorithm successfully predicted 47 out of 63 patients who has normal BMD results. Osteoporosis is an important pathology that increases the risk of bone fractures. And there are a number of studies using CT and X-ray to predict osteoporosis by using texture analysis. These studies usually use femoral head and vertebral bones. There are very few MRI studies, and these studies not using the sacrum. Therefore, we try to determine the relationship between bone marrow fatty chains and osteoporosis using the MRI of sacral bone. As I conclude, There is an association between osteoporosis and bone marrow adipose tissue. Magnetic resonance imaging is promising to be able to predict osteoporosis with texture analysis-based machine learning algorithm and with no use of ionizing radiation. Radiologists should be cognizant of significance of fat depositions while evaluating sacroiliac MRI. There were some limitations in our study. This is retrospective and single-center study. The number of patients was relatively small, and the other important limitation was absence of external test set. These are my references, and thank you for your attention.
Thank you, Dr. ESAT. Any question? So, Dr. ESAT, still bone densitometry is still have higher specificity more than MRI, according to your study?
Sorry, first, what more
yes,
than MRI?
Bone densitometry analysis is still highly specific more
yes,
than MRI?
Yes, still this is higher than MRI, but we researched and we wondered the relationship between bone marrow fatty change and fatty change in the MRI image according to BMD results.
Okay, thank you.
Next speaker, Dr. Noor from